Greetings, everyone. Welcome to the IFAM seminar series event, the Osher Center Grand Rounds. I'm Dr. Melinda Ring. I'd like to take this moment to also welcome our online viewers. Be aware, please, that we don't necessarily monitor the chat during the seminar. So when you have questions for the speaker, please use the Q&A function, and then hopefully we'll have some time at the end to answer them if time permits. So it is my great honor and pleasure to introduce my friend and colleague, Dr. Lori Walsh. Dr. Walsh earned her medical degree and did her pediatric training at Northwestern University, and then completed her fellowship in integrative medicine at the Andrew Weil Center for Integrative Medicine at the University of Arizona. She has precepted, taught, or mentored Northwestern medical students and residents ever since completing her residency, and I'm happy to share that she now serves as our co-associate director of education for the Osher Center at Northwestern, helping us teach future physicians and other healthcare professionals about the concepts of integrative health. Dr. Walsh's current clinical practice at Advocate Healthcare is as an integrative medicine specialist with a real focus on nutrition and lifestyle. And through her work at the Smart Farm, which hopefully we're going to hear more about today, which is located actually on the hospital property, she supports regenerative agriculture, health equity, and environmental sustainability. So with that, I am happy to turn it over to Dr. Lori Walsh to give us her talk on soil health to human health.
Thank you so much, Dr. Ring. So I wanted to talk this through the lens of my role as a pediatrician first. So here's the areas I want to cover. And also, since most of you have awareness of this field, I want to just show a little bit of how does a pediatrician move into this area, and how am I using that role to build what I'm doing. So the idea of, children's health and nutrition, to outline some connections between human health and soil health, and to illustrate an example of a farm on hospital property, and also talk a little bit about the pediatric literature showing the value of micronutrients, which is a way of also looking at the plants, and then looking at how culinary medicine can begin to connect the dots with what's going on. So this is the center we have at Good Shepherd, and it really was a vision using philanthropy and then the goal of the hospital to bring more health to the hospital. And here's my view as a primary care pediatrician, where I started watching childhood illnesses increase and not really understanding what it was, and maybe not even being able to focus on it. We know that some of these issues that are coming up are mediated by immune, endocrine, and respiratory systems that are being compromised, but really I don't think we were actively doing anything in our day-to-day life as general pediatricians because of other time pressures. Also, this idea that obesity is increasing worldwide. I do some work in childhood obesity clinics as well to build health. And then the bigger picture, which I think pediatricians are very good at understanding, this idea that if we can really help kids and women, pregnant women, these adverse childhood experiences that lead to many of the downhill problems that we see as we age can be prevented or improved upon. So looking at nutrition, it really just seems like it should be the center of everything when you look at it this way, of how it affects our mental health, our physical health, our ability to fight infection, metabolic health, recovery from surgery. It really affects every part of what we do in a hospital system, yet we don't really focus on it enough at visits. And then when we look at it as a society, health equity, or even national security, there's not enough people to join military because of some of the issues that we have, and even healthcare costs. It all comes down to nutrition, or a lot of it, I should say. So this always, makes me happy thinking about children and the way they move through the world, and how can we begin to change that? So within integrative medicine, we know this, but within the healthcare system, a lot of what we do is focus on things that are wrong versus how can we create salutogenesis to support human health and well-being. And one way, obviously, is through nutrition. So beginning with this idea that I think that we're in competition with these food packaging, that the idea that we're not clear in our society that the cereal box is not the soil, and it is no comparison to a food grown in soil, which is rich in complex organic matter, that could be the same as cereal that's been processed in a food processing plant. It's just not the same. And this is a pictorial of what has happened to our microbiota diversity. There's many ways to look at this, but this is one way to see that we've changed. And as we've sanitized food and we've restricted crops that are grown, then we also are seeing changes in our own health over time, and in a short period of time, actually. So this is a picture of the part where our farm is now, called the Smart Farm is the name of it. And really the idea is to bring high quality produce into those who have food insecurities and those who have medical issues, and then to bring that in to what we do at the Integrative Medicine Center, to use it to teach how to prevent and manage chronic disease. So that's the mission of the farm. We have partnered with Rodale in that they are collaborating with our farmer. If you don't know who Rodale is, they're really one of the largest, well-respected researchers of soil, and they began a farming systems trial in 1981 that's still active today. And they were comparing the nutrient concentrations in vegetables and fruits just in the soil, and then when it's been conventionally and organically grown. The interesting thing is they do notice that there are different content of minerals and vitamins in the soil, but it's pretty interesting that there's actually not a lot of research on soil, that this idea that there's a connection, but to make these really tight correlations is still in process. So that's something important to know about, but it's also important to know that we probably only have about 60 years of topsoil left. So what's the idea of regenerative agriculture? This is one area that they are promoting and we are doing on our farm, is the idea that quickly that we could have no-till, least disturbance, so those microbial roots are building. We can use perennial crops along with annuals. We can use natural fertilizers and pesticides, compost, use cover crop, and if there's livestock, to manage that grazing and to use biodiversity. Here's a slide that I thought helped me as a non-farmer understand some of the complexity of conventional ways of growing, regenerative, organic, and then this other category of regenerative organic. And so it really produces plants in the regenerative organic area that are healthy so that they're resistant to disease and insects, that it regenerates the soil, it sequesters carbon, and it develops microbial populations while growing the crops. And it values and utilizes the innate intelligence of nature, which is such a beautiful way to look at it. And it does change farming practices to more organic, and also has other practices, as mentioned, with cover crops as well. The other big area here, though, is that it focuses on the fairness for farmers. Farmers are really suffering with getting done what they need to get done, and they need the support as well within that system to have good work boundaries. So then there's this idea that Rodale has also brought up, is this regenerative healthcare. So how can we then think about having farming and healthcare work together to have a prevention-based approach for human health, where we have less toxic chemicals in the agriculture part and we use less pharmaceuticals. So it really looks at a way to put that together. And they've had 2 regenerative healthcare conferences that have focused that. And we've had farmers with physicians and nurse practitioners and dietitians and food companies come together in looking at this. So it's a really lovely way to pull everybody at the table. So this is just a general look at how many farm to hospitals there might be out there, and there's not many. And so within this advocate system, we are the star's a little diverted there. If you know Illinois, we're not on that side of the lake, but in any case, we are up in the top of Illinois, but it's a bigger system now. So the idea is, how do we work with a hospital system to look to see what the needs of the hospital system are and use that language to then present it back as, this is what we can do if we can use what we have in front of us. So this is an aerial plot of the hospital land. It started as a farm. And now, and barns have been left there. So there's been art in the barn. And so there's some of these facilities that have still been part of it. And the smart farm was located on the blue star, and now we'll be moving to the green star as we move along. But you can see the amount of property. It's about 200 acres. And the current impact of the smart farm that we have is that we donate close to 8 tons or 16,000 pounds of organic produce to local food pantries, to our community, to those that are at the hospital, either working here or visiting. And we're also moving it through the system. So here's what started a couple years ago, is looking at, of all these hospitals within the advocate system in Illinois, how could this produce be used most wisely, and then to use it to promote health beyond our boundaries here. We're in a pretty wealthy zip code, but there's food insecurity all around us, and then there's much within the system. So the idea then is looking as, what do hospitals want? The one of advocates' areas of impact, which is really all hospitals, is advancing equity and also environmental sustainability, but also to improve chronic disease. We're not going to be 80% of what goes on for health is really happening outside the hospital. So how can we build, some ways to build health that way? We looked at food insecurity and looked to see that Trinity on the south side had the most need. And then a food pharmacy pilot was started, where there's our food from this area is transported down to those food pharmacies during our growing season. And then we have a growth plan, which we are definitely behind on. We're more from 0 to 1 year, but we are starting to really be able to move. We're building new farm buildings to move us closer to the integrative center, and to be able to go to this 5 to 6 acres, and also to be able to move more food. And then we're fundraising for a teaching kitchen. So hopefully that will be able to be built. We started something right away. So we are collaborating here in the Integrative Medicine Center with some other areas of chronic disease management. So it allows us to easily collaborate and give out these farm stand vouchers, and give that out to people during the growing season so they could use them. So the idea then is, why do we need culinary medicine? This is something I present more to people within the administration, but the idea is that we know that what we know to do is not really being done. And I think that's really what we focus on in integrative medicine is, how can we bring forward things that we know into a hospital system? So culinary medicine, as you know, is evidence-based, and it blends this idea of food and cooking with the art of science and medicine. And as I've navigated from doing general pediatrician to being in integrative medicine, and for adults and children, but also working to bring integrative within a hospital system, I've used the language of culinary medicine because I think it's more understood by people and more actionable, at least in terms of first glance, until they get to know other parts of integrative. We know about nutrition as micro and macronutrients, but we know we also need to learn how to plan and shop. So it needs to be a bigger picture. We also know we're not learning this in medical schools, and once we're out, we're not learning about it as much either. Teaching people what the best way to eat is the wheelhouse of integrative medicine, of individualizing it, looking at the person in front of us, looking at what we know are good practices, and trying to use food more as medicine before we start using other modalities. So this is a blast from the past. So when I did general pediatrics, I was the education director, and I felt really proud of putting these up in each room. And as I look back on them now, I realized, well, 1992, we were really giving messages out that really that were misinformation. But 2005, really didn't even make any sense. As I look at it now, I realize it's really hard to know how to eat, and everything was sort of equal going up to a top. So we really haven't done the best job of educating. Of course, we have the healthy eating plate, which is really excellent. It's easy to see, it's easy to read. It has some culinary information on it. It's really, really well done. My favorite is still the this pyramid, because I feel it has the culinary pieces with it. You can click on it. It combines my love of Asian with the idea of also the anti-inflammatory way of eating. And so when I teach people, I'm able to show them quick information about what they can, what's valuable to add into what they're eating, how to cook it. And then portion sizes, you can see through the way these are labeled on here. So mushrooms, of course, are pretty wonderful, and teaching people the value of these within medicine, of how we can use them to solve some of the issues. So when I talk to people, when we're talking about children in the child clinic I do for kids that are overweight, is when we're talking about the microbiome, why can't we think about adding in mushrooms? We know that they have effects on all these areas, depending on what we're focusing on. So using it as food or using it as a supplement. So key points is always this idea of, eating real foods, always enjoying meals, buy foods locally and in season, and be wise to marketing, which I'll talk about in a minute. These NOVA classification has been very helpful. I think it's helping us define in the world that we live in, that it is a way to try to categorize food. It isn't really, it talks about the food processing. It might not say exactly what, it does nutritionally, but I think it's a way for us to say that these foods are causing health problems. And for me to show patients, here's something to take away, but the word process is not necessarily a bad word. There are processed foods that are actually, benefit our health and what we do. So going back to this idea that real food grows. So if you are reading a label, to learn how to read it, and this new label is helpful, but I still think it takes some understanding of how to navigate it, especially when you're in a busy grocery store. So teaching key areas to pay attention to, just the idea, if there's a bunch of language at the bottom, you can move on. If you can't understand the language, probably not a good one. So really looking at label reading as we teach. And then the idea too of this health halo effect that seems to be spreading. And I did hear that there is a big company that's buying another big company, that's going to change how they do soda. So it does make me think that the labeling is going to be even more important to pay attention to. So on this one, it looks like a lovely, refreshing herbal tonic. So when you read made with real fruit juice, it contains 10% juice. When you read herbal tonic, if you look down at the bottom, it has Eleuthera, Schisandra, but it's not labeled in any way to make it clear that it's anything that has any benefit of those herbs in this product. And it's prescribed as a prescription. So very clever marketing. When you look at the actual label, though, you can see it's 2.5 servings is in the container. And if you just paid attention to sugar, you'd move on. So really teaching people to read the labels as clearly as they can. And then this is my wish, is that we could do more advertising of these kinds of foods. We just don't see this around. And so what I do in one of my clinics at the Children's Hospital is to show this poster, having more ways to show people visually what maybe the advertisers are doing on the opposite way. Would you want to have 6 donuts? If you would, then that's going to be a hard sell. But if it does mean something different. And then this, I talked to really the registered dietitians that are giving these recommendations, some of the oncologists. When you have a cancer patients, why are we giving something that has 3 areas of sugar in it, almost no clear nutrition, and a lot of irritants to the gut, when we really could be teaching something different? How could we teach somebody how to make this inexpensively and really get a lot more health benefit from it? as a part of a meal, not just the only thing. So to change directions a little bit, just thinking about mothers and children, this has always, been my area of love and focus, is that, how can we go back to the future? In little tiny writing on there, it says, oh, he was going to be late for dinner. And does anybody even think that anymore? I think that's something that I really focus on, is, do people eat together? How you eat, some with whom, sometimes, can be almost as important as what you're eating. And how can we go back to the future, where eating can be, what some of us remember was like. And how can we look at this idea that we have all this data out here about the first 1,000 days we can support pregnant women, infants, and toddlers? What would that look like to help them thrive and have less disease and issues going forward? So when I speak to parents or to other pediatricians, it's this idea we often learned in pediatrics is you would just learn from the resident ahead of you. What should I feed? I don't know. I'm not sure. I think it's rice cereal, but I'm not sure there was any data on that. We have data now about food allergy, but why are we not just giving veggies as the first food, understanding that resistance is going to happen, and help support parents to eat, and maybe even help them eat their own vegetables, because I find that's also an area to support them in. And this really idea about most things in life, that we need to be patient, be positive, and be persistent. But it is not easy to feed young children when there's a bunch of them with different ideas. So this idea of how can we help them eat their vegetables, parents as role models, putting them on the plate, not touching, no forcing to eat, stay positive, putting the vegetables out first while you're cooking. A lot of kids will just eat them if they're not at the table. Try different cooking methods. Ask kids to explain why they don't like them if they have language, to say, oh, it's too crunchy or it's too spicy. So it's not just no, but it's no, and this is how I like it. Because there are ways any vegetable can be delicious for most people, and just also staying positive. I love giving culinary tips. Two of my favorites are talking about broccoli sprouts and the sulforaphane, and how you can make these yourself. And if you don't, and if you do, how to be careful when you make them. And also if you want to buy them, there's easy ways to buy them. And as they start to get wilted, to put them in the freezer, and then you can just put them in drinks. So you're not wasting any of the foods, because as we know, food is expensive, and these are still potent in a lot of different ways. And then the value of turmeric, which you can buy a tray of it at specialty stores for $2, $2.50, and then chop it up in little tiny slices and use it as a way to add to foods, as an easy way to add an anti-inflammatory. And then chamomile is one of my favorite ways to help, but you can almost use this at any age to help calm, or as an antispasmodic. Just a lovely way to transition in the day. So using teas is another favorite of mine. So I'm going to transition now over to some of the data that's out there. So trying to get the attention of my colleagues, mostly in the pediatric world, where we just don't see articles about nutrition very much in ways that we can act on. So I looked at the work of Bonnie Kaplan, and have really enjoyed this, and collaborated with her and some of her colleagues to look at this idea of broad spectrum micronutrients and the data on improving mental health in children and adults. And what does that mean? How do we translate that into what we're doing within medicine? And we know that these foods have micronutrients, but we also know, going back to the soil, that a lot of the soil is depleted. It just doesn't have in what it needs. And so how can we know what we might need to supplement, like magnesium, or if people on certain medications that deplete it, what they might need? But how can we use food or broad spectrum micronutrients if somebody has an issue, to support them in a safe way? And so showing this, I know we all had to memorize this in medical school, which I don't think we really need to do. I think we can just pull it up and look at it and see where all these vitamins play a role as cofactors, and how are we going to get them in if we're eating ultra processed foods that literally don't have them. how can the brain possibly be happy? So the work of some of the things that I bring in is the work of, this is Jeanette Johnstone and Eugene Arnold and team that do these placebo-controlled randomized controls trials showing that micronutrients make a difference in certain areas that are significant with attention deficit, but it's not actively being used in pediatrics right now. And we know that the medications have side effects that have long-term side effects in terms of cardiovascular side effects. Also looking to see this idea that fruit and vegetable intake is inversely associated with the severity of inattention. So where can we start with just asking kids what they're eating and really focusing on that while we're also helping them with their attention deficit? And then this was just published by Dr. Ruckledge on the use of broad spectrum, they're basically the prenatal vitamins for 12 weeks, or excuse me, postpartum to prevent postpartum depression, which then improved the neurodevelopment of the child. Just beautiful. And then some of the other work looking at the prenatal vitamins are too low in choline, that we need closer to 900 milligrams of choline. And that data is building, but it's not actively being done in a lot of the prenatal supplements. So just getting back to then, what's the practical part of how do we move forward? So just looking at fiber, whole grains, nuts, seeds, beans, fruits, and vegetables, and then the addition of fermented foods. So the world of the microbiome researchers are teaching us all that these prebiotic foods, but not prebiotic foods that are in your soda, that seems to be what they're going to be marketing next, but foods can be really helpful to our health. And this idea that this high fermented food diet increases our microbiome. I don't know that all the answers are out there yet of what to do, but we know that food can be the beginning of the answer. So this is how I look at it and have interpreted what I've been looking at is how can we add a little bit of probiotic food a couple times a day. And for kids, kefir is really a nice one, but there's always something that can be added in here. So teaching people, if they're not used to these things, how do they find it? What would be a reasonable thing if you're pregnant, what things you might need to avoid. But most can find it. And culturally, these have been part of a lot of people's ways of eating. So just trying to just thread that back in for what they do. And what we do at the farm is we create these food pharmacy spotlight. There's a little recipe with collard greens. I had not used many collard greens, and now I'm using them so much more, understanding how to use them and then understanding the great nutrition involved. And then I asked the farmer to tell us about them. What is it about them that we should know about that would be interesting? So we have a little farmer fact piece that we're adding in to those handouts. On the big picture, there was the White House Conference on Hunger and Nutrition. I'm hoping that continues to be pulled, but it has activated many that are working in this field, like the Teaching Kitchen Collaborative and so forth, to be able to do more teaching and activate the monies available to do that. And also our local Gaples Institute here with Stephen DeVries is doing a lot of teaching in this area. So we hope that that will continue to build health as we work to educate those that we train the trainers, so to speak, on how to bring this forward. Locally in our community, we have philanthropy that allows us to have a health summit. We've had 3 of them, and we are working to bring community members and also physicians together to discuss health in the way I wish a lot of my medical conferences went, where we can really, they're like an integrative medicine, conference, and trying to drive that within the community and the hospital. And then I'm going to end this with a quote from Dan Barber. It's really, first of all, it's really fun to be working on a farm, working with a farmer. But here's what he said in his book, The Third Plate. He said, he was quoting, it was a Mennonite bishop who said, he found out that they didn't use any rubber tires. So he said, well, why wouldn't you do that? And he said, well, when do you start raising a child? And the bishop said, it's 100 years before the child is born, because you start building the environment they're going to live in. And rubber tires mean easy movement. Easy movement means the farm will grow, which means more profit. More profit leads to more acquisition of land, means more machinery. And pretty soon we just don't have as much intimacy with what we're doing. And that loss of knowledge can eventually, change what we're doing. So that doesn't mean, we can't grow, but I think we all know those areas. And I know I work best when I'm with a team that I can, understand and work with. But the idea that we need to start, changing these, what we're doing now is, working for the future as well. So these are my key takeaways: that nutrition is key to the planet of our health, our people, and society. There's much to discover about how soil affects human health, which was surprising to me that research is still being generated. But I think we can still connect the dots to all of this. And regenerative healthcare is a system where we can work with farmers and work together: less pesticide, less drugs. Hospitals can shift their focus in a way. They need to understand how it feeds into what their missions are, and there probably needs to be philanthropy to support a lot of this in the beginning. And then culinary medicine is an evidence-based field that blends the art of cooking with the medicine that we know, and it's a way to bring healthcare of farm to table. And then this idea that we really can change what we're doing in medicine if we can bring evidence forward, begin to teach people how to eat better, and how it can benefit their health, that we don't have to use as many drugs for kids. So I will stop there, and I have any slides that you might want. I've got a bunch of resources, but I'll stop there.
Thanks so much, Dr. Walsh, Lori. We have plenty of time for
You
questions.
do? Yes, I didn't realize that. Yes.
And we have one in the Q&A, but if other people have questions for Dr. Walsh, please feel free to put those in there. The question there is, hello, I'm an aspiring pediatrician who's worked on developing nutrition curriculum for middle school students. Because kids are at such an impressionable age in terms of self-esteem, body image, etc., one thing I've struggled with is how to present nutritional guidance without reinforcing that there's an ideal way to eat or look. So the question is, how do you navigate that as a pediatrician and nutrition educator?
Yes, that is such a good question. And so what we do is, first of all, find out where they're at, and how they're eating, how they view eating. So I think that's the first way, so that you're getting a sense. And what we do in our Healthy Active Living clinic, one second, I'll grab it, is we use the plate. I mean, it's so basic, right? But I start with the plate because it helps to frame out what we know is helpful is getting more fiber in, right? But the other parts of the plate, they can put whatever they want in, so that we don't try to take things away. I found it can be overwhelming when there's not a clear way to eat, and then there's this idea that something's better than not. So just looking to set up an idea, if they're willing to, use the plate. Getting an understanding of their knowledge of fruits and vegetables. How is their family eating? Because kids are really at the mercy of their family. And so we bring the whole family in when we're talking about food, because I'll find that everybody in the family might have a different way of eating, and that's why this person is presenting that way. So you really need to think about, how can the whole family be part of the discussion? Find out who the lead person is in the family that's willing, parent-wise, that's willing to lead the charge, because there usually needs to be that. And if not, then it's the beginning of learning how to cook some things. If there's cooking classes in middle school, to take that, looking for opportunities for learning, and then making things quick. So if somebody needs to use a plate and doesn't know how to cook, how can you use an apple cutter to just cut that apple right away? Grab some peanut butter, to get a salad that's already made, stick it on your plate. So there's ways that we navigate that. I also love to have people sit and eat. I think that's another problem. I know was for me when I was doing general peds. I was eating and typing, and I realized it wasn't really helping me. So to sit and eat when we eat and be mindful of it, whatever it is, to sit and eat it. And if there's a possibility to eat, as a family. The other things we do is we give them some resources, very, simple resources. We give 2 or 3 bullets of ideas of, here, try to add a protein and a produce when you eat. And here's a tiny sheet of how to do that, so that when you're eating, you can remember to combine things, that you're trying not to skip meals. I know there's intermittent fasting, all kinds of things, but most people need to feed their brain, and most teenagers need to feed their brain. So, to create these ideas of what could you do to create a time where you sit and nourish yourself, a few times a day. When there's things like social parts, like eating with friends, if, I try not to take those away, that for middle schoolers, they might need to go out and go have fun with their friends. So to not make that something they can't do anymore, but starting to see where there's opportunity as they start to be able to navigate this. Could they pick different things from the menu of that place? But that's a later conversation. The earlier conversations are really about, what do they know about food? Who's eating in the family? What's their access to food, and what's their knowledge about how to put it together?
I saw a stat recently that, and I'm sure this is even more so for middle school teenagers, college age, is that the number one source for nutrition and health information in general is social media, and physicians were number 3. So I think especially for young people, that's a real issue because of such misinformation, fads, the person who posed the question said, so much of what's on social media is about looks, not about health. And so I think as a field, we just need to do more to counter that in a healthy way. There's a question, and I know health equity, and you shared that the farm actually produces a lot of food that then it gives to people. I know there's a lot of work out there about produce prescriptions. So there's a question about, how do you balance the issue of food cost with the importance of healthy food in patients and families with low incomes?
Yeah, I think we learned that from, the idea of culinary medicine, and that how can you feed somebody as cheap, as inexpensively as you can within, where their cultural background, of where they can get food and where it's accessible. But, frozen vegetables are always, something that can be used. We use a lot of beans. So we look at culturally where they can get what they need. And then to, how to navigate the food store is part of it as well. So where are you shopping? If you shop at Aldi, we know how to help you find good. So the dietitian that I work with knows exactly what to use there. So I think a lot of times people don't know what they could add in as fiber that is not expensive, that could add into whatever else they're doing. So that's where we start. We meet them where they're at and culturally see what they enjoy eating, and then use those foods. So it would require me like having a person to give you an exact, but that's generally what we talk about.
Thanks. There's another question about children and teens with avoidant restrictive food intake disorder, sometimes evolve from food allergy avoidance behaviors. And do you have any tips for how do you approach that when maybe a parent brings in a kid or a teen who is just on a very restricted diet, that may have stemmed from real allergies or may not? Is
Yes.
that something you see in your practice?
Yes, for sure. And I think that, you can understand how it could happen to any child who's, had something. I know that there was, one of my colleagues, who was teaching hypnosis to these kids, was working with the food allergy department for a while, because this idea that, how do you help kids navigate when they've activated their, their fight or flight related to food, so starting there would be helpful. If the child has a food allergy, how can we proactively help parents navigate foods in general? Because I'm sure they're activated as well. And how vegetables and fruits or vegetables at very least are very, very safe. So really working to see what is going on for the whole family, because sometimes there's more than one picky eater in the family, so to speak, and then how to begin to touch food without having to eat it, learn about food cognitively is a great way to do it, but no pressure to eat it, right? But it does need to be offered, where it's somewhere on the table, where it's not this, we're going to give you what you always eat, or we're going to get up and go get you what you eat, because it doesn't lead anywhere in the end. Now, I say that with a big, black box of like, it depends on the person and the family, but in general, that's what we support parents in doing. And then some of these kids do need a feeding therapist to help with feeding therapy, whether they've got, something that is related that can be helpful to be desensitized within the mouth. But I do find the cognitive way and also, getting involved with food in a way that doesn't pressure them to eat it, and then offering are the three areas that I try to focus on at first for those kids.
Thanks. Um, Going back to the soil and the farm, and I'm not totally sure what state this is in at the hospital at this point, but like, do you foresee patients, including kids, getting involved with the food production, getting their hands dirty? We know there's some benefit to nature therapy and everything from exposure to soil microbiomes to just the connection to being in nature and something outside of a screen. Is that something that is part of what you see happening at the farm affiliated with the hospital?
Yes, that's definitely it. The farm location, if you remember where that other star was, you'd have to drive and go around the corner. Now it's really, a stone's throw away from where we are, and it's expanding so that we will, and we, if we able to build a teaching kitchen, it's going to be able to have a place for people to land. And what we're doing now is building that idea of who can we bring in, all of those things for physician wellness or cancer patients coming out to help. We're going to be growing cut flowers to be able to bring into the hospital. We're growing medicinal plants because our farmers can grow them from seeds. So I'll be putting them in the garden that's right outside where I work, starting to bring those in, do teaching with them, using them. So really expanding all of that. And it looks like we might have somebody who can help us do a regenerative berry farm where we could grow aronia and blueberry and so forth. So we just, expand our ability to provide that. So that is in the next stage of planning.
Wonderful. I know, we talked briefly about this, but being in a major urban setting downtown at Northwestern, it feels a little overwhelming. I'm like, oh, I wish we had place for a farm. I know you brought up green roofs as an option. I think, wouldn't that be fabulous to have? I think in federally qualified health centers and in some of the more community-based programs, for example, the upcoming Bronzeville clinic that's opening, I know there will be a small teaching kitchen there. And many federally qualified health centers do have a local garden where they'll grow produce and culturally relevant herbs and spices and things that patients can then use. So I do hope we see more of that. It's not something that we're taught in medical school as part of healthcare, but it is the core of what is health. So I hope we see more and more of that.
Yes.
Do you have any other comments or thoughts you want to add before we close? There are no other questions in the chat.
No, just the idea that this can be done really anywhere. This is, just landed into this, but this can be done on all levels anywhere. And then the idea that I think the administration of hospitals needs to be educated on these things. So the more they become part of it and see it and hear patients talk about it, that's what I hope will reverberate, so that this area of medicine grows, that,
Yep, literally.
literally and figuratively.
All right. Well, thank you so much,
Thank you.
Dr. Walsh, and thank you everyone for being here. We'll see you next time.
Bye-bye.